the news on Rainier Avenue Radio.
A new variant of the coronavirus has been detected in Washington State. Per Patch.com, the B.1351 variant was first identified in South Africa in December, but has since been found in 10 states, including this latest case in Washington. The case was identified in a King County patient who tested positive for the coronavirus back on January 29th. The Department of Health says any other details on the patient or the potential spread of the variant remains scarce, as the patient could not be reached through contact tracing efforts. Experts say now that the first case of the variant has been discovered, more are likely to turn up. Though these cases have recently been on the decline, these variants could undo that progress. B.1.1.7 does not appear to spread more easily or quickly than the predominant strain. However, it may be more resilient to vaccine.
And that's your news on Rainier Avenue Radio.
On RainierAvenueRadio.world, look for the Change Your Food, Change Your Life show. I'm Dennis Weaver, your good food guide and host, helping you to feel good and look good, and who wouldn't want some of that? All that and more from the Change Your Food, Change Your Life show on RainierAvenueRadio.world. Stories, songs, and guests. Begin living the organic good food life, and the rest of your life just may be the best of your life. Always up, baby, to your health.
How would COVID vaccines work in your body? Here are 3 things to know. Number 1, a vaccine is basically a training session for the immune system. Vaccines teach the immune system to look for the key features of a virus. So when a virus does show up, it's ready to fight it off. Number 2, a vaccine gives your body a plan to recognize the virus. Then your immune system starts preparing by making antibodies, or fighter cells, that stay in your blood as protection in case the virus tries to invade. What this means is you get immunity against the disease without having to get sick first. Number 3, when enough people's bodies know how to fight off a virus, it has nowhere to go. That slows the spread. When people get a vaccine, we're able to stop the spread quicker and get closer to ending the pandemic. To learn more, go to covidvaccinewa.org. A message from the state of Washington.
Would you like to see when your favorite Rainier Avenue Radio show comes on? Check out our show schedule, updated weekly at RainierAvenueRadio.world.
Welcome. Still not hearing myself. All right. I'm not hearing the mic. I hear you fine. Huh. Okay. Well, if you hear me fine, we'll rock with that. Oh, there we go. That's a little better. We had a new piece of equipment in here, and you know how initially the new technology is supposed to make things better? Well, sometimes you have to work the bugs out. Welcome to Rainier Avenue Radio.world. It's me, Tony B, and this is our weekly program, The Impacts of the Coronavirus on South Seattle and Surrounding Communities. Almost 1 year to the date, we broadcast our last high school sporting event. It was the 3A and 4A championships down in the Tacoma Dome. And of course, we had an idea at that time that something was going on, could be pretty big. I say that to say because tonight we're broadcasting our first high school sporting event of 2021. Since that point in time, the first one is taking place here in the Metro League. We're going to be broadcasting high school football. We'll be kicking this off with Seattle Prep taking on Ballard. Then Rainier Beach will take on Garfield. That's tonight at 5 and 8. And then on Saturday, West Seattle takes on Cleveland. So good to have high school sports back. And similar to that, I have not had an opportunity to talk to our health officer. And we had a great conversation since last year. And so I want to welcome the King County Health Officer, Jeffrey Duchin, to the program. Jeffrey, how are you?
I'm doing well, Tony. Thank you for having me. How are you?
Under the circumstances, Jeffrey, I'm fantastic. Fantastic. Under the
Good to hear.
circumstances. Well, before we really get started, and I know we don't have a whole lot of time, and I'm not going to be asking you, to kick out a bunch of statistics because we can find those. We got to know each other last year, kind of over the air, in the midst of what was going on. And so, before we get started, how are you doing? I mean, how are you doing? Seriously, it's been almost a year. How are you?
Well, thanks. I appreciate your asking. I'm tired. It's been a long and tough year, for all of us, including me. And I'm really looking forward to better days soon. I'm hoping that if we can get over the next couple of months, with more people vaccinated and continuing to see disease rates drop, I'm going to take some time off. So fingers crossed.
And again, I'm not trying to get all in your Kool-Aid, Jeffrey, but I mean, the other parts of your life that have had to coexist while you've been doing this, how's that going? I mean, because this has affected everything. It's affected everything.
Yeah. Well, on the personal level for me, it's pretty much just work for the last, over a year now, starting last January, since the first case was found in Snohomish. I used to be an endurance athlete, but that's history at the moment. I spent a lot of time cycling and swimming. That was most of my, discretionary time. I used to see my children frequently. But yeah, it's pretty much all work at the moment. Looking forward to a little break from that in the next couple of months.
So, well, thank you for your service. Appreciate it.
I thank you for that.
Let's start off by talking about where we're at right now overall with COVID. And maybe you can put this in some terms that might mean something to people right now. And I'm going to say in comparison to last year. Because there are some things that we know. We know now that over 500,000 people have died.
Mm-hmm.
We know that the economy was flipped upside down for a while.
Absolutely.
We know that racial disparities and systemic injustice never left. They're there. Maybe even stronger. We've also seen incredible compassion from our community. We've had political debate about this being used as a political football. A lot of stuff. So where are we right now with COVID? Almost a year later. Where are we right now as the health officer for King County Health? And let me, does it bother you when people say the Dr. Fauci of Washington? Does that bother you? Or are you like, hey, I'm the Jeff Duchin of Washington State?
I've been called a lot worse. I admire Dr. Fauci, so I take that as a compliment. I try and take most things as a compliment. But Fauci's that's a good thing. So with respect to where we are, Tony, I felt that we were just swept up into a storm of uncertainty and of unprecedented challenges over the past year, both with respect to the magnitude and the duration and just the downright unfamiliarity of this new pathogen. And where we are as a nation is variable depending on where you live. But here in King County, I can say that we're in a much better place than we were last year at this time, and we're in a much better place than we were even a month ago at this time.
Even though at that time we were facing an unknown, and there was concern, people were literally wondering where their next dollar dime was going to come from. Jobs were lost. People were out where you feel like right now we're in a better place.
I think we're in a better place because of where we're heading, because of our direction and our trajectory, because I think we are seeing the opportunity to put this behind us, which we didn't see last year. These vaccines are really going to allow us to get back to something close to normal, I think, by the summertime, if we don't let these variants slip out of our control. So in that sense, I think we're in a much better place because real recovery is, I think, truly within our grasp, whereas a year ago, we still didn't know what to expect.
Okay, so let's dive in this a little bit thicker right now. Where has Washington been over the course of this past year in our ability to deal with everything that is engaged in this from your perspective as health officer? And by that, I mean our health system. How did it survive? How did it hold up? Our general population health. Where were we in relation to the rest of the country? And then on top of that, how effective were we with dealing with the health disparities that impact, in particular, Black people, Pacific Islanders? We now know how they were impacted. How did we do in a year relative to the rest of the country as health officer in those areas?
Yeah, I think we did well. If you look at the incidence of cases, the rate of cases, and the rates of death, Washington State ranks relatively low, and King County in particular ranks incredibly low, second from the bottom with respect to other large metropolitan areas with respect to the number of COVID-19 cases, incidents, per capita. We have seen health disparities, as has the rest of the country, and I think that currently we continue to see them, which has been our priority in the context of our vaccination program, to try and have equitable vaccine allocation to address those disparities. But we know that we are still seeing overall 4 to 5 times the rate of COVID-19 among Hispanic and Latinx residents and Native Pacific, Hawaiian Pacific Islanders, and 2 to 3 times the rates among Black and African American and American Indian Alaskan Natives, 23% higher among Asian Americans compared to white. So we have significant disparities that have been experienced across the country. And as you say, Tony, these are just a reflection of the underlying systemic issues, the social determinants of health, the economic factors, systemic racism, and other upstream causes that lead to poor health outcomes even before and outside of this pandemic. And so I think in the sense that they've really spotlighted these inequities, I think our country may be more, it might be a better moment now to try and address them so that they just don't fade away and be ignored again to the extent that they were, and that led to these dramatic inequities. I was just looking last night at some other data around influenza vaccination, and we see the same things. With influenza, with all of our chronic diseases, we see that communities of color, lower socioeconomic communities, communities that have experienced longstanding systemic racism, have higher rates of lung disease, of diabetes, of obesity, of smoking, of poor health outcomes from a wide variety of causes, and lower rates of vaccination for influenza, which is influenza vaccine, which is a preventive measure similar to COVID-19 vaccine. So, none of this is new. And the reason I think we might be in a better place is I am just sensing around me more people being aware of this inequity, that how unfair this is. And hopefully our leadership in our country has changed, and hopefully we'll be able to talk more seriously and openly about our past and how to move forward and address some of these problems.
Tell us about the infrastructure of our healthcare system. When this initially happened, folks who needed surgeries, folks who were going to have maybe some things that weren't so serious, got booted out, kicked back. We were concerned about whether there was enough protective equipment. The country was.
Mhm.
The infrastructure of our healthcare system, well, what is that like? What have you learned? Were there any things, even as internally speaking with other physicians, and that you can share with us over the past year where we're at?
Yeah, well, I would say that we are fortunate here in King County. We have an outstanding healthcare system that works well together, which is incredibly important during a crisis. They share information, they share resources, they support one another, and they work well with our public health system. And we did not have, overwhelming numbers of patients during the COVID third wave, this large third wave, which, by the way, was responsible for 3/4 of all of our cases, half of our hospitalizations, and half of our deaths. Just this one, wintertime third wave that we had. But the healthcare system was able to manage that. Now, unfortunately, there are issues that were known prior to this outbreak around pandemic preparedness that were not adequate. The issue of personal protective equipment, there was not enough, and there still is not enough for all the healthcare workers to use it as recommended. And there are issues around the personal protective equipment for the public as well. The quality of masks that are available to the public, but the surge that some of the other parts of the country saw, this is not something that we can say we are out of the woods for locally. We saw many parts of the country where healthcare systems are overwhelmed. And what that means is not only is it more difficult to provide the usual type of care that we expect for people who might come in with COVID-19, but it's very difficult to provide the usual type of care that people would expect who have a car accident or have any other trauma, a heart attack, a stroke, have cancer. And we know that many people in our community and elsewhere, did not seek healthcare during COVID-19 because they were afraid to go out or to go to a hospital, and that's led to delays in diagnoses. And it's going to take us quite a while to really sort out some of that collateral damage. There's so many things that this outbreak has affected in so many ways that our physical and emotional health that's going to take a while to actually quantify. But the healthcare system here, I think, is robust. It's highly functioning, and the only thing that I worry about is too much relaxation going on right now. People not continuing to take precautions and understand that this virus transmits from up to half the time from people before they have symptoms. It transmits through the air. The importance of indoor ventilation and reducing infections. I worry about the potential for these new variants to cause another wave of infections that could be very high. But if we can prevent that, I think for just a couple of months, as more people get vaccinated, I think we may be out of the woods with respect to having the worst of this behind us and having the worst impacts on our healthcare system behind us as well.
Thank you. And I'm gonna move on, but you know how we get down. We have open, honest, fair conversation here. That within that infrastructure, do you know if it's doing okay? Is it working okay equitably for everybody after a year? Can you get is everybody getting the type of care that they need, or because there's people out there, Jeffrey, and I don't know. That's why I'm asking you, who might say differently, who might say, yeah, from your perspective, this infrastructure that's holding up quite well, is it working for everybody?
I can't say that, Tony, because I think it was questionable that it was working well for everybody before COVID. I certainly don't think it had improved in the way it's addressing inequities in access to healthcare and how people get treated in healthcare settings during this pandemic. I mean, we know that there are disparities in the type of care people receive and their access to care, insurance, benefits, being able to take time off to seek healthcare and get treatments, that are longstanding. And I think those are existing to the extent today that they did before COVID, I don't think this outbreak has done anything to improve that situation. But I don't have any measures that I can share with respect to specifically, how the healthcare system has responded to COVID. I mean, we know that, case rates, hospitalization rates, death rates are higher in people of color, particularly in our Hispanic and Latinx community, but also our Pacific Islander, Native Hawaiian, and a Black and African American as well, to a lesser degree, but still elevated compared to whites. And there are many reasons for that. But many of those reasons are upstream reasons, not simply related to access to healthcare. So I think that our community has relatively high levels of access to healthcare, for people who need hospitalization. But whether people have, good access to a primary care doctor that can help them avoid hospitalization, I think, is an issue that is probably not equitable. And I don't think I don't have any information to understand whether that's changed or improved during the COVID outbreak.
You're listening to Rainier Avenue Radio .world. It is our special broadcast of the impacts of the coronavirus on South Seattle and surrounding communities that we do every Friday. Speaking with King County Health Officer in Chief Jeffrey Duchin. Let's talk vaccine for a little bit here. What do we know that you can share with us now about the efficacy of these vaccines? The Johnson & Johnson just came out. I guess AstraZeneca is coming out. There is some question, and I mean, you're the expert here to ask this about whether the Johnson & Johnson with the one shot is going to be as effective. How's the whole 2-shot thing working out? How effective is that first shot? Do we know anything now? Any further information that science can tell us about the vaccines?
Yeah, this is something that's actually good news about the pandemic. The vaccines are all great. The 3 that we have licensed are great vaccines by any standards. The 2 mRNA vaccines each require 2 doses. You asked about one shot. It appears that meaningful protection starts to develop about 14 days after the first shot, but you don't develop complete protection until about 14 days after the second shot. So you get partial protection between the first shot and the second shot. Now, these vaccines were all studied. The mRNA vaccines, which are the Pfizer and the Moderna, they were studied at a time different from the J&J vaccine. The J&J vaccine is got some very attractive features, but it's hard to compare head to head as far as effectiveness. But I'll tell you what we know about it. The things that are, I think, very attractive about the J&J vaccine are that it's one shot, so you don't have to come back for your second dose. Another thing that I think is attractive about it is that the incidence of some of those more severe side effects appear to be much lower. So with the first and particularly with the second shot of the mRNA vaccines, significant number of people will feel pretty sick. They'll get fever, feel very weak, run down. Some people, have to take a day off from work, headaches, fatigue, muscle aches, and so on. That appears to be much less common with the J&J vaccine. Similar, spectrum of side effects: sore arm, pain in the injection site, some fever, some feeling under the weather, but the degree of severity is much lower. Also, this vaccine can be stored in refrigerators. Doesn't require special equipment like the Pfizer vaccine does, and is more stable for longer periods. So it can be administered in locations that don't have that special equipment, which is very attractive. All 3 vaccines are highly effective against what is most important, which is severe COVID-19. So hospitalizations, nobody that received the J&J vaccine was hospitalized or died at 28 days or more after their vaccination. That's how long it took the immune system to sort of kick in and respond to the vaccine. That's pretty similar to what you see with the Moderna and the Pfizer, where it's either 28 days or 35 days after after the first dose, that your immune system is probably got a very good, almost complete response. So about a month after your first dose, you've got a high level of response again, and all three vaccines are comparably protective against severe outcomes. The J&J in their study showed an 85% vaccine effectiveness against severe disease and a 72% effectiveness overall. And I know people see that number, and they may see the number that says 66%, which includes study subjects from other countries, from South America, Latin America, and South Africa, where the variant strains are circulating. So, this J&J vaccine also has shown protection against severe illness due to these variant strains, which is very encouraging. But it's hard to compare these numbers head to head, because studies were done in different countries at different times with different viruses circulating and different levels of COVID-19 in the community. So, I think it's safe to say they're all excellent vaccines. People obviously should get vaccinated as soon as possible. I think that's as soon as you're eligible, that's the main goal. If you've got a reason to prefer one over the other and you have a choice, that's fine. But I think most people will just be able to access one or the other vaccines. And I would be comfortable assuring everybody that these are all great vaccines.
Okay. And I don't want to, I got to kind of put you in a rapid fire situation here. And I appreciate you taking the time and the detail with these answers. Just have so much to ask you. If you get the vaccine, can you still, are you still someone who can carry it and give it to someone else? If you've had the vaccine, can you still catch the coronavirus, have it, whatever, and pass it on to someone else, even though it doesn't affect you?
Yeah, you can, but the extent to which that happens is probably greatly reduced. We don't know exactly yet, but for example, with the Johnson & Johnson vaccine, which is the one we have the most data for currently, it appears to reduce the risk for that asymptomatic infection by about 2/3, which is great. So it's likely that the other vaccines also reduce the risk for asymptomatic transmission, and there are data beginning to come out on this. So we're trying to, over time, put it together and understand exactly how much protection against asymptomatic disease these vaccines offer. But I think it's going to be significant, but not 100%. So someone who's vaccinated, is at much lower risk of getting a COVID infection, not knowing it and spreading it to someone else, but not zero.
Do we know yet? Is there any science that's telling us these are things to expect as side effects, even if it's a small number of cases? Do we have enough sampling to say these are the things that the vaccines do that are adverse side effects?
Yeah, I think so. I mean, we've had all in all now, talking about, 60,000 plus people, in the study arms who've got vaccines, and they have similar side effects. It's a question of severity. So the types of things that are most common, is people call reactogenicity. It's pain at the injection site, redness at the injection site, swelling, fever.
Anything long term? Anything that we know? I know it hasn't been that long, but anything long term that we're seeing,
Well, yeah.
I know
Yeah, you can't really say long term at this point. I mean, we have for these vaccines to get approved, they had to have observed their vaccinees for an average of 2 months after vaccination, and that's when the vast majority of any adverse events occur. But things that are extremely rare can turn up later. But we're talking about needing to observe millions of people in order to detect something like that, and there just aren't that many people vaccinated. I can tell you that there have been no warning signs for, in the data that have been studied for the vaccines that have been, used up until now, the mRNA vaccines, there have been no serious safety signals detected as up until last week, which was the last time I saw the data presented by the CDC. So that's encouraging, but extremely rare things, 1 in a million events, for example, like this anaphylaxis, severe allergic reactions, they happen like 2 to 5 per million, and hasn't been anything else, similar to that that's turned up at this point. And those allergic reactions happen at those very low rates with many of our vaccines and other medicines.
Okay, appreciate it. Got to break in on you again really quickly here. Have you been able to aggregate information? And I'm jumping right into something that we didn't even touch on, to be able to determine whether the vaccine has been distributed again equitably, and in particular among those who are most vulnerable or who have been bearing the brunt of getting this worse. I know there's always a problem about finding that data, what that means, whether it's whatever. But have you been able to aggregate that information so that you can tell if the vaccine is getting to communities that need it the most?
Yeah, absolutely. And let me just let your listeners know, you can see it yourself. We are very serious about this data. We track it closely and we make it public. So if you go to our King County Public Health COVID-19 dashboards, you'll see a vaccination dashboard there. And you can look at the rates of vaccination coverage according to part of the community, where someone lives in the community, and also by race and ethnicity. So, for example, right now, I can tell you that if we're talking about adults 65 and older, 57% of white adults 65 and older have been vaccinated. 45% of Hispanic Latinx adults 65 and older have been vaccinated, and 39% of Black or African American adults have been vaccinated. 64% of American Indian Alaska Native, 73% of Native Hawaiian Pacific Islander. And so we do track this very closely, and this is how we
that almost is the infrastructure that's in place to vaccinate people. The people who have the best infrastructure set up are getting. We're almost out of time. That's why but I want to give you an opportunity for final words. We're actually, but I gotta, first of all, good talking, but I want to give you final words here before we go. I've been firing these questions at you for whatever message that you want to give to our listeners right now.
Well, thank you, Tony. First of all, I love talking with you. Thank you for inviting me. First of all, I want to say, I want to express condolences to all your listeners who have lost family members, friends, loved ones, who have been ill themselves, who are caring for ill people. This has been a terrible year, and I hope that it is over soon, but I want to express my sympathy and condolences. We are working hard to address inequities in COVID-19 rates, and particularly stopping them through vaccination. We are reaching out to community organizations that serve BIPOC communities, that serve those communities that have been hardest hit. And we encourage people to get vaccinated as soon as they're eligible, because that is the quickest and surest way to protect yourself, protect your community, and to get this pandemic in the rear view mirror. But until that time comes, please understand that we remain vulnerable, that these variants pose a real threat, and that by limiting our activities, wearing face coverings, and paying attention to how this virus spreads, airborne and ventilation, we can get there with many fewer additional cases and hospitalizations and deaths. But ultimately, we will get there, and within a few months, I think we'll be in better shape. And I appreciate everyone's patience as we grapple with the limited vaccine supply and these last few months of rigorous COVID control measures.
Hey, Jeff, thanks for joining us. Coming up a little later in the program, the way that we decided to kind of do this year anniversary, if you want to call it that, was to take a look at where we were. And so we're actually, right after this is done, we're going to replay the interview we did with you a little less than a year ago, so folks can see where we were at that time when I asked you how we're doing now. We're also going to replay a conversation with the emergency feeding program, which had been overwhelmed for food at that time. And actually someone broke in and broke into one of the refrigerators at the emergency feeding program. And we're also going to replay the conversation with Patricia Myers, the mayor of Yakima, where we early found out what was going on. They were in a different place than we were at that time. They got there. They got to where we were. And so a lot of stuff, Jeff, we didn't get to talk about. We didn't really get to talk about the state, but I wanted to zero in on King County. I didn't even really get to narrow down on South Seattle like I wanted to, but I do appreciate you joining me, man, and sharing this information. And I didn't want to cut you off. I was like, I got to let him talk, you know. I don't want you to be relegated.
I tend to go on a bit.
Well, we appreciate it. We appreciate you taking the time.
Thank you so much. Stay
All right.
well.
So coming up, you know what we've got. You can have a chronological look back at what's been taking place. And then tonight, starting at 5 o'clock, high school football back again. We'll be kicking it off with Seattle Prep and Ballard. That's at 5, and then at 8, Garfield and Rainier Beach. And then tomorrow, West Seattle and Cleveland at Memorial Stadium. You can check this out on our YouTube page. You can check this out on our Facebook page. You can watch on those. You can watch on our Twitch. Of course, you can get the app where you can download and you can, for free on Apple and Google, and you can do both, watch and listen. You can just listen on TuneIn app. You can just say, Alexa, play Rainier Avenue Radio. You can go to our website and listen. So yeah, let's take this opportunity to enjoy our student athletes getting back into action after a year of no high school sports. Thank you for listening. That's it. That's all the time that I have. That's going to do it for the kid. Stay tuned now. It's me, Tony B. And remember, whether you believe you can or whether you believe you can't, you are probably right. I'm out. Peace.
For all the sports that's happening in Seattle. Seattle Sports Weekly on Rainier Avenue Radio.world.
Namatti hin dabarsina. Yoo dargaggeessi vaayirasii kooroonaatiin dhibame homaa ittiin fakkaatu fi dhibeen baay'ee itti hin mul'atu. Garuu akka keetitti yoo kennite isaan akka keetitti dabarsan. Osoo hin beekne namni guddaa guutuu ni dhibama. Kanaafuu itti yaaduu qabdan waa'ee vaayirasii kooroonaa irraa akkamitti namatti dabraa jettanii itti yaaduu qabdan. Namni baay'ee walitti akka hin geenye harka keessan dhiqachuu qabdan. Yoo mana taa'uu dandeettan mana taa'aa. Nama irraa of eeguu qabdan. Namatti illee hin dabarsinaa. Ergaan kun uummata tajaajila raadiyoo Rainier Avenue World fi Somali Youth and Family Club irraa isinii dabarsina.
Check out Fresh Juice on Rainier Avenue Radio every Wednesday night, 9 to 11 p.m.
As we bring you the hottest new hip-hop, dope guests, and interviews with artists on the rise.
Plus, you can kick it with me, D-Money, and Evan B. Culture.
Every Wednesday night, 9 to 11 p.m. on Rainier Avenue Radio.world. Fresh Juice.
This is Paul Pearson, host of Star Time. And when I'm not helping bad girls set up their websites, I'm listening to Rainier Avenue Radio.world.
What is the coronavirus? Coronavirus is affecting people's ability to go unanswered questions about the coronavirus. I feel like we're not getting the whole story about the coronavirus. There are several patients at the hospital who are at end of life. What is the coronavirus?
Coronavirus disease 2019, otherwise known as COVID-19, is a respiratory illness that can spread from person to person. Patients with COVID-19 have had mild to severe respiratory illness with symptoms of fever, cough, and shortness of breath. There is currently no vaccine to protect against COVID-19. There is no specific antiviral treatment for COVID-19. If you're concerned and you have symptoms, don't go to urgent care. Call your provider or call the ER or urgent
If you
care.
don't have anyone's number, call King County's coronavirus line at 206-477-3977. Or if that line is busy, you can try 1-800-525-0127.
This message is a public service announcement of Rainier Avenue Radio.world.
What is the coronavirus?
Got Funny, live on Rainier Avenue Radio.world.
Every Tuesday, 7 p.m. to 7:30 p.m.
You got funny? Bring it.
Hey y'all, it's me, Deontay, your host for Got Funny, where we got comedians, laughter, and a whole bunch of other. Join me Tuesdays at 7 p.m. to 7:30 right here on Rainier Avenue Radio World.
The coronavirus is real. Let's be diligent about washing our hands. Did you know that this virus can live on surfaces for up to 9 days? That's why it's also important to disinfect things that an infected person might touch, like your cell phone. Even if you wash your hands often, when you pull out your phone, those germs go right back on your hands. When's the last time that you cleaned your phone? When the virus is spread by sneezing or coughing, those tiny airborne droplets eventually land on surfaces that you touch with your hands. On average, we touch our face 16 times an hour, which is why it's important to wash your hands and wipe down commonly used surfaces, including your cell phone. This message is a public service of Rainier Avenue Radio.world.
What's on your heart? Are you exhausted at the lack of progress for people of color in business, politics, and life? This is Cindy Bright, the host of Heartbeat Radio. Each week we explore this heart condition in the country that is affecting you and me. We have real conversations about what's necessary for change. It's time to change this dialogue. Will you join this Heartbeat weekly, Wednesdays at 7 p.m. on Rainier Avenue Radio?
This is Rainier Avenue Radio.world.
Welcome back to Rainier Avenue Radio.world. It's me, Tony B. This is our special show that we're doing every Friday now. We started this on March 13th. When we were just getting into the throes of the coronavirus and things were beginning to impact, and we knew that it was important for us to get messaging out to our community and then also share the voices of our community during what turned into a pandemic, and the need has just continued to grow. We've continued to broadcast and share information. Right now, joining me is Mr. Virologist. This is going to be an interesting conversation.